what are the ways to prevent it, and what is the best way to identify those who are at particular risk for sudden cardiac death?
You're just right. Sudden death is obviously highly, highly dreaded. And so in one small area, you have the genetic abnormalities with rhythm disturbances, the long QT syndromes, where if there is a family history of this, we are much better now at understanding the genes that are associated with it, and we can assess other family members to see if they have those genes, and if they do, we can take care of them in the right way.
And long QT syndromes identified on electrocardiogram.
It can identify it on an electrocardiogram. There are many gray areas on the electrocardiogram, but that's where it's helpful if there really is a family history, and then you add the genetic information to it. There are many more issues in terms of sudden death in people with some type of structural heart disease. So some of the structural heart disease could also be genetic. The hypertrophic cardiomyopathy group, for example, the arrhythmogenic right ventricular dysplasia group, and those also can have a genetic component. So if there's some kind of family history, then people can be screened for that. Their genes can be assessed, and you know how to follow them. But the much larger group of people with sudden death fit into people who've had some problem with the overall pumping capacity of their heart, in the absence of a problem with blood flow to the heart. So those we would call the non-ischemic cardiomyopathies. Many times there may be a genetic component to them too. And then the big share that we worry about are the ischemic cardiomyopathies, so patients who aren't getting enough blood flow. When patients are brought into a hospital following an arrest, and they are taken to the catheterization laboratory, at least half of the time we will find that they have a occlusion of a blood vessel. So in terms of how to prevent sudden death, taking care of the blood vessels is a big deal, of course. Identification in families that are at risk is a big deal, and also identification of patients who have problems with the overall pumping capacity of their heart is a big deal. Despite all of that, we know it's an enormous issue, because once patients get to the hospital with a heart attack, we can take care of them.